Question 40. Elbow dysplasia, ununited anconeal process. The UAP, mostly in large breed dogs.
Okay.
So, yes. So, we have elbow dysplasia. So, it's ossification center failure of anconeus the ossification center failure to fuse with olecranon at 5 months old, and that will lead to osteoarthritis, yes, of the elbow joint bilaterally. And the etiology could be genetics, hormone functions, growth plate trauma with rapid long growth periods. The signs is that lameness, obviously 4 to 5 months old, abduction of elbow when walk, paw is onwards. Paw is onwards.
Did you say onwards or outwards?
It's outwards, yes.
Oh, okay.
Yeah. Rotation at rest, pain at full flexion or extension, and joint infusion. The X-ray. Do we have the X-ray? Yes. The X-ray, we will see acute flexion of elbow, moves the anconeal process distal to medial epicondyle.
Okay.
In Young's, you are going to see thin linear black space between anconeal procession and olecranon. This thing here.
Did you say the black line is what it is?
Yeah, I think this is the issue.
What's
here.
the black line exactly?
It's they say here that it's a thin linear black space between anconeal procession and olecranon. That's what you get when you have elbow dysplasia in X-ray.
Because you said there's a lack of ossification there.
I think because it's displaced and it's ununited, so it's lack of ossification, so it's ununited, so you can see a gap.
Okay.
I suppose. In older animals, that's the second picture, I suppose. Anconeal process is completely detached and lies in supratrochlear foramen. I don't know what to say, to be honest, but okay. Yes, so treatment, surgical excision or remove of anconeal process. So we just remove it, the one that it's not fused.
Okay.
Joint will become unstable, but it's important to know that if we remove the anconeal process, the joint will become unstable. So have that in mind. Alternatively, remove the inflammation and degenerative changes. If we have early removal before arthrosis happens, so we say that that will lead to osteoarthrosis of elbow joint. If that's not happened, we have good prognosis. The process is with pictures, I suppose. With pictures.
Oh yeah.
Don't know if you can understand here. So we expose the elbow from the lateral approach, free the anconeal process. It's ununited, so it's not difficult to do.
No.
We remove the fibrous tissue with narrow osteotome, grasp the process with small pointed bone clamp and remove it. To expose the elbow, so in order to go into that position, we need to go through some muscles or things.
Okay.
So in size proximal to lateral humeral epicondyle, we move to the epicondylar crest, we move to the anconeus muscle, obviously, and we see the joint capsule. After we incise the capsule, we have the anconeus process that is exposed. So we expose this. And
By cutting those muscles.
and this is the anconeal muscle, I suppose.
Oh yeah. Okay. Lovely.